January 18, 2018. I'm Lai, an intern at Toa Payoh Vets. Today, this 31-month-old female Siamese cat is being discharged. She can now walk on her own. But what happened to her?
Of course, we have to check the whole leg. Although X-ray showed the fracture is here, but I just check. So first of all, we do by palpation first. You can see any swelling or not. When there's no swelling, then you know, and there's no pain here. So it's good that the vet didn't give painkillers. So now we do palpation. We will know exactly whether, if there's no pain and swelling, that means it's, this part is not affected. Even though even if the X-ray, you will know because of observation. You observe, no swelling, and palpation, no pain first. Yeah? Because if there are other areas that will be painful. Okay, so now this part to the hock, there's no pain. Now we go up. This is where the pain is, and this is the knee joint, quite knee joint, and then we go upwards. But by right, this one shouldn't be painful unless there's fracture. But okay, the cat, this is the tibia. This is not the bone. The femoral bone is the one fractured, which we can see on X-ray. I'll show the X-ray. You can see there's no swelling. Now the fracture is at here. This is the femoral head. That means the thigh bone. And this part also not very well done. By right, there should be a good X-ray here. No, but anyway, you can see the femoral head has a fracture, and I show the owner that there are other fragments there. One here, which you will remove on surgery, and this one is a useless fragment. And this part, we will put the pin, and then this pin will go through, and then we go through the head, and then after that we push it upwards to the hip there. And so these two broken pieces will join together as a one straight piece. Okay, now we see the other view. There's the other view. A blister 1/3 femur head. That means the shaft is blister 1/3 fracture. This is considered midline, and this is the proximal 1/3. 1/3 proximal 1/3, middle 1/3, and blister 1/3. So now I do the fraction extension. There's no pain there, no pain. Okay, then now I extend the hock. No pain, that means no fracture, no dislocation. Abduct and adduct. Okay, now this is the dangerous part. This here, we go up. We go up here. It's 4 days already after falling down. Definitely there's swelling here. Okay, painful, there's swelling. And go up. Now you can see actually, you can see the displace from the X-ray. You can see this femur is forward, and the other one is backwards. So this is where this is the thigh bone, the femoral bone. And now we go to the hip. The hip will be here. Now this cat is quite a good cat. Actually, most of them will just scratch me. The hip is here. So looks like there's no hip dislocation. So X-ray already confirmed a fracture.
Day 5. Surgery. Distal 1/3 femoral shaft fracture. A pin and plaster of Paris is placed and will be kept on for the next 8 weeks. The pin unites the fractured fragments and protrudes to stabilize the fragments. The knee joint is still able to flex and extend. The cast was placed as the fracture is too close to the femoral head, so pinning is insufficient to stabilize it. Home nursing. Now, the e-collar has to be kept on, as the cat would otherwise lick the cast, wetting it. She might also bite it off. The cast must be kept dry, using bandages. Review by the vet must be done every 2 weeks to check on the cat's progress. The cast is to be removed in 6 weeks, ideally. Take note that if the paw is swollen, the cat must be brought to the vet immediately. Week 7. Removal of cast and pin. The sticky bandage is removed, followed by the cast being sawed open using an electric saw. There is some infection, which is normal and can be treated with antibiotics. The pin is removed as well. This is what the pin looks like. The cat is now able to walk on her own. She is free to go home, but must wear an e-collar to prevent her from licking and irritating her left leg. In conclusion, since this fracture is so near the joint, the outcome for normal walking and jumping upon full recovery is not as good. She is likely to suffer from arthritis, joint pain. This way of getting injured seems to be fairly common. Let us take a look at some other cases treated by Toa Payoh vets. Case 1. In 2015, a male, 2-year-old cat fell from the 5th floor, causing multiple right femoral fractures. Case 2. In 2016, a 1-year-old cat fell 3 stories and fractured his right hind leg. 3,500 was quoted for treatment of the tibia and fibula fractures. Case 2.